My name is Lynn Mathre. I'm a registered nurse, master's prepared. 1995, a co-founder of Patients Out of Time, and I'm the president of that organization. In 2010, I co-founded the American Cannabis Nurses Association, was their first president. Now I'm just a past board member of that organization. You know, historically, my background with cannabis was learning that it was helpful for patients with cancer patients for chemotherapy. As a nurse, I didn't work on a cancer unit in my early years, but I knew many friends who would just, we learned to put a towel under the door if the patients were going to smoke or just go someplace else and ignore it and let that happen. But when I went back to school to get my master's degree and did my survey, I did a survey. It was the disclosure of marijuana use to healthcare professionals, surveying patients who used cannabis. And at the time, when I did that survey, it was marijuana, because that's all I knew to call it. This was 1985, 84, 85, and I only knew to call it marijuana. But that last question on my survey was, what are your health concerns about cannabis? And they could answer from a list of items, worried about its effects on their brain, on their lungs, on their heart, on their fetus for pregnant women, and I had other. And patients started writing in. I'm a multiple sclerosis patient, I use it for spasticity. I'm a spinal cord injury patient. That was a wake-up call to me. From that time on, Normal asked if I would be director of their Council on Marijuana and Health, which I agreed to do, which put me in contact with the likes of Dr. Norman Zinberg, Melanie Dreyer, people who had been studying cannabis for many years and knew more about it. And as I started reading, I learned it was cannabis, I learned it was an old medicine, and it changed everything. Founding Patients Out of Time, we really thought, we'll educate the healthcare professionals. Once they understand it, things will change. And it wasn't until our first conference was in Iowa City, Iowa, the heartland of America. But that was Melanie Dreyer on our board of directors, who's pioneer in cannabis research. She's the woman who studied pregnant women smoking ganja in Jamaica and was able to show that it did not harm babies. But Melanie looked around with her colleagues. She was the dean at the College of Nursing at the University of Iowa. She went to the College of Medicine and said, if we can't talk about it at a university, where can we talk about it? So that was our first conference, and it opened the doors to having conferences since then. Our third conference was back in Charlottesville, Virginia. Now the University of Virginia was willing to do it, but we were smart by this time. We got the university, the School of Nursing, the School of Medicine to join, and we asked Richard Bonney, a well-known lawyer in the whole war on drugs arena, and Richard Bonney is also the author of The Marijuana Conviction, which gives the whole history of how marijuana became illegal under the Marijuana Tax Act. The mission of Patients Out of Time is to educate healthcare professionals and the public about the therapeutic use of cannabis. So in many ways, my time is spent a lot on just educating, answering phone calls for anybody and everybody, and speaking wherever somebody wants to learn about it. But our conference series focuses primarily on the healthcare professional. We clearly have it open to patients, and many patients come, and they come because their healthcare professional doesn't know anything about cannabis. Many of them have been kicked out of doctors' offices or been told they have to go into a drug treatment program if they want to get any more medicine from the healthcare professional. So they come and the patients come to feel justified, to learn about it, to network, just to feel better. They've been stigmatized and they don't like it. But our main audience, I would say, is healthcare professionals. And part of that is, as a nurse, I really believe it's our ethical obligation to fight for cannabis. If there are health policies that legislators who have no health background are passing laws and they affect patients negatively, a healthcare professional ethically should not remain silent. And this prohibition to cannabis has been a little too intense because healthcare professionals have just remained silent. They won't say anything. I feel like they put their head in the sand, and I just think it's unethical. The good news is more and more are recognizing that it is medicine and recognizing that they have to do something about it. When we started the American Cannabis Nurses Association and nurses would join, they said, "Is your list confidential? Because my employer can't find out. I'm afraid if they find out what they'll do to me." As a nurse myself, I actually was the addictions consult nurse at the University of Virginia, running patients out of time. And that was a bit of a conflict. The director of nursing understood that and was supportive of me. On the medical side and the administrative side, they just as soon not know anything about that. But as a nurse and as an addictions nurse, patients would feel comfortable talking to me about their use. And as a nurse, I felt perfectly legal and no problems of talking to the patient about how to use it safely. If you could actually have one unit where physicians could recommend cannabis, they could use cannabis on their patients versus another one, my prediction would be you would have patients doing much better, nurses feeling like they were actually doing nursing care. It would be wonderful. It would be better care and better savings. Because right now, I mean, I've done a lot of hospital nursing, whether it be in the Navy, where I started out as my nursing career was in the Navy, or later, I passed a lot of pills. And what we find, you give a medication to some patient, and pretty soon you've got to come back and give them something for the nausea that it caused, give them something for the constipation, or help them because they fell out of bed because they got confused from the medicine. We spend our time giving medications and medicating the medication. And very often you don't see the patients getting better. And again, I guess that's why I say that nurses, we're the ones that are giving the patients the medicines. We're the ones that are seeing what happens to them. And when you see them using cannabis and you don't see the nausea and vomiting, you see this restful sleep, you see them eating well, you see them talking to their family members. In hospice patients, actually having patients alert and being able to say their goodbyes to their family. This is where it does get emotional. But that's probably the biggest place. It is most helpful. That's one area that's a tough one for me to talk about, and veterans is the other issue. It's just, you can't be a healthcare professional and watch that and then walk away. There have been instances with patients that I've seen in the hospital or elsewhere where they've talked about their use and the fact that they've had to hide it from their family because they would never approve. Actually, we're in a small town in Howardsville, Virginia, a very small town. And the woman who runs the store came in to tell me, she often confides in me when she knows patients need it. But a very good friend of hers, the young girl, sick with cancer, and they weren't looking to cure cancer or anything, but just suffering in so much pain, couldn't walk, they'd have to carry her places. She was barely eating, she was wasting away. And Dad was, no way was she going to be using any drugs. No, we're not going to try marijuana, no matter what. Finally, the mom sneaked it to her, and she tried it. And it was that day, she was off someplace, and they came home, and she walked from the car into the house. And her father was just, what's happening? You know, I don't understand what's going on. And they finally told him after that. And that's happened so many times. It's a relative, they don't want their child using it, they don't want a loved one using it. Patients Out of Time has had a struggle, and breaking the myths is a tough one. It's the docs who've taken the time to understand cannabis, recognizing it. And the other thing that's really amazing, I think for all the states that have passed the laws, they're seeing the patients thinking that they're going to get these young kids who just want to get high, and they're finding out it's, the elderly, middle-aged patients suffering from chronic pain, from serious illnesses. And they soon learn it's not about getting high, it's about feeling better. And the other big success Patients Out of Time has had is introducing people to the full benefits of cannabis as a full plant, with the cannabinoids, the other cannabinoids working together, the terpenes in the plant working together, that synergy, the entourage effect, to the point that out of our conference and other conferences, especially in Europe, but our conference in the United States, or there's a counter conference that they do in Europe, teaching about CBD and other cannabinoids, that Project CBD was formed to literally educate growers that it's not just about the THC. THC is very important, and people should never dismiss THC. But the plant is much better as a medicine when it's balanced and has some of the other cannabinoids in it. When I did learn about cannabis, when I did my history to find out that there were all these different products back prior to the Marijuana Tax Act, there were remedies for your topicals for corns, little plasters of cannabis, there were tinctures, there were tablets, all sorts of different medications, and there were medications that veterinarians used back then. We've gotten away from it. The recreational users started smoking cannabis, and so that's what everybody knows, to smoke it. Well, smoking is good because it works right away. For someone who's nauseated, that's a good medicine to take because it works so quickly, but it doesn't last that long. We do have worries about the lungs, but they're not that. Donald Tashkin's work would tell us all that it's not that big of a danger of smoking. It's not at all like smoking tobacco. Smoking cannabis, the cannabinoids that enter the lungs actually heal against the smoke. But as a nurse, we would recommend for patients to vaporize instead of smoking for most patients, because it would heat the marijuana, the cannabis, to the point where the vapors can be inhaled, but no smoke, no burning. So they don't have any issue of that, but it still gives the quick relief which can be needed. And I bring that up because some patients might need to smoke cannabis. Kathy Jordan would be an example, a patient with ALS. The smoking actually dries her mouth up, makes her cough. And for patients with Lou Gehrig's disease or ALS, that's how most of them die. They choke on their own secretions. So in her case, that would be something that you would actually possibly recommend smoking cannabis. And she doesn't need that much anyway. But for patients, there are so many different routes to take, whether it be a tincture, a cannabis in an in an alcohol base, or oils, concentrates of cannabis that patients can use, and they can take those oils by mouth. Very often just put them under their tongue, on their gums, let it get absorbed. Works fairly quickly, not as fast as smoking, but literally fairly quickly, will last longer. Patients can take edibles, the oral route, take it by the gut. Now the problem that we have with that when patients take it that way is cannabis goes into the stomach and right to the liver before it gets into the bloodstream, and the liver breaks it down to another chemical metabolite called 11-hydroxy-THC, which is more psychoactive than THC. So sometimes there's two problems with the edibles. One, you might have a stronger reaction than you wanted, but two, it takes a long time. So it's taking an edible is a great way for something long-term where you want a steady state, so to speak, of that medicine. But patients need to take their time to figure out what the dose is. So taking a brownie, taking a quarter of a brownie or however, take the bite. We would say wait a half hour, maybe wait an hour. Do you have any effects? Nothing? Take some more. And what happens, unfortunately, is patients, if they don't get guidance by a healthcare professional or by someone who knows what to do, they don't feel anything, so they take more. And it can be a very disorienting feeling to overdose on it. The overdose is nothing dangerous, but they could be very nauseated. They could become very dizzy, not being able to stand up, feeling so terrible they don't want to try it again. And it was just the wrong dose for them. But edibles are really good for someone for long lasting. There are also topicals. Patients with arthritis are putting it on their joints and literally having these hands like this to put it on their hands and to just be able to go. And you just see it within minutes. They're just amazed that they can move without the pain anymore. But there's also what we call transdermal patches, a patch that you would put on where the blood vessels are here, like on the inside of the wrist or the inside of the ankle. These patches can last up to 12 hours. So it's giving the medicine over time. Veterans have tried it and reported back that it's been like their first good night's sleep that they've had since coming back from Iraq or Afghanistan, because it literally will last that long and let them go to sleep. But suppositories. In Jamaica, they make Canisol and Cantamol. Canisol is a cannabis-based eye drops for glaucoma patients, and Cantamol is cannabis and timolol, a glaucoma medication for glaucoma patients. So you can do eye drops, almost anything. Probably the one way that we don't give it that often is IV. And to an extent, it's not necessary. Intravenous cannabis the cannabinoids are fat soluble, so they don't easily, you can't give them IV that easily. You'd have to change the chemical structure a little bit. So if somebody needs it immediately, they could just inhale it instead. But other than that, almost any way you could deliver any other medication, you can use cannabis that same way. And patients need that kind of a guidance, because when they're learning from other patients, very often they're just learning that you smoke it, or they learn to use an oil. So again, patients need to understand if they get a product, it should be labeled correctly. Then they need guidance on how to use it. Sometimes, I guess the other issue with dispensaries, patients go in there and oftentimes seeing a bud tender who is thinking more on the recreational use, and not all dispensaries. There are some dispensaries who are great, but we've seen patients go in and they're like, oh yeah, try this flower. Oh here, yeah, try these edibles here, and the patient leaves with all these different kinds, and they take more than one. They might smoke something, they've taken an edible, and the next thing you know, they've had way too much. They feel terrible. It didn't really help them because they felt so bad, and they're not going to try it again, simply because they were never dosed correctly. The way that we always try to tell patients is, you'll hear it over and over again, start low, go slow. But we start at a very low dose and see how the patient takes it. If they don't notice anything, fine, up the dose, and you just keep upping the dose until they feel great. You get a little higher dose and they're going, well, I'm not sure. Back down. That's your dose. And it's individual. I think that's the other big thing about cannabis, which is tough for healthcare professionals today. Our physicians are trained about pharmaceuticals. So they're used to this chemical, and I'm going to give you, 50 milligrams of it, or depending on what else, if it's liquid, so many milliliters of it. They want that specific dose, and they kind of will do it maybe by weight. Sometimes it's milligrams per kilogram of a person's weight. So a big guy is going to get a bigger dose than a little person. With cannabis, it could be totally different. We could have a 90-pound older female getting a heavier dose than a 300-pound young male. It's just whether it be their endocannabinoid system or for how that's functioning, the reason they're using it, whatever. There's a lot of things going on, and the cannabis formulation, that it's very individual. This is one medicine that really talks about personalized medicine. Each patient will figure out what works for them, and it's going to be different than another patient, and it's going to be different than a patient with the same kind of a problem. So it's just, and I think our healthcare professionals they're not comfortable with that. They're not comfortable with the patient figuring out what works best for them. It's kind of like letting go a little bit of the control, and I don't think they like that idea. And yet, cannabis is so safe. Again, from a nursing perspective, I've made mistakes in the past, and I think almost every nurse, you pass so many medications, you make mistakes sometimes, and it's very scary, because we could kill somebody. We could do permanent harm to somebody if we give the wrong medication. With cannabis, it's like there really is no harm that's going to happen, especially with one-time use. They might not like it, but it's not going to hurt them. There's going to be no permanent damage. So the idea of letting patients use a medicine that they can figure out what the best dose is, it's okay. Because, as a nurse, I can look back and I can be watching them, I can advise them, but I'm not going to feel like I've got to rush in and help them. They're not going to stop breathing, or they're not going to have these serious problems that I'm going to have to concern myself with. Blood pressure's not going to bottom out. I think everyone should have access to the sacred plant. Cannabis is a very, very special plant. For those who don't know anything about the endocannabinoid system, healthcare professionals, they really need to understand this, and I think the light bulb will go off for everyone. We have this system in our bodies that keeps us in balance. It's essential for good health. And what we've learned about cannabis is it was a medicine that was widely used throughout the world, widely used. Then with the Marijuana Tax Act, it became a forbidden medicine. Then it became the last resort. If nothing else works, some of those federal patients, nothing else works, okay, then we'll let you use cannabis. The more we're learning about it, people are waking up to saying, wait a minute, this should be first choice because it's so safe. So cannabis, it is a sacred plant. It is something that feeds this system that literally governs everything about our body. I mean, the endocannabinoid system is like the master programmer in the human body, as well as all animals, and you need to keep it healthy. If we're not feeding ourselves, our own endocannabinoid system can't be healthy. So we're in a kind of a really weird state. You've got a plant that cannot kill anyone, even if you make it concentrated. You know, you take out the medical part and you make it concentrated. It cannot kill anyone. It's got all these benefits, and we have prohibited it. We have taken it out of our diet. We've taken it out of our culture. It's a crime.